Hello, I'm Dr. Keith Martin, the Executive Director of the Consortium of Universities for Global Health, and thank you for joining us on our ongoing series of leader interviews. Around the world, there are more than 82.5 million displaced people. 35 million of those are children under the age of 18 years of age. This is the largest displacement of people since World War II, and it's growing. I'm very pleased today that we have a leader in the International Rescue Committee, Dr. Mesfin Tessema, who's the Senior Director of Health, to share with us some of the challenges refugees are facing and what can be done to be able to improve the lives of those who are displaced, not through any fault of their own, but as a consequence of conflict, climate change, and other actions that are, in my personal view, are really political failures that have resulted in people fleeing for their lives. So without much further ado, it's my great honor, Dr. Tessema, welcome to the interview today.
Hi, Keith. Thanks very much for having me.
Wonderful. I know this is a very challenging time for everybody, and particularly for the great teams at IRC. So people may not know about the IRC, but it was founded, or at least at the behest of Albert Einstein back in 1933. So please tell us a little bit about the IRC, what its mission is, and what it is doing around the world.
Yeah, thanks, Keith, once again. Of course, the International Rescue Committee is one of the world's leading humanitarian organization, as you have noted. It was established at the request of Albert Einstein in 1933 to help people running for their life in Europe. So since then, our work is more important and still growing. And today we are talking about this topic at a time where Europe is also again bracing for a major conflict. It's something that's my honor to talk about, the organization I work in, the health unit I lead. So at the IRC, I will use that one just in a shorthand, which stands for International Rescue Committee. We help people affected by humanitarian crisis to survive, of course, recover, as well as gain control of their life, basically for their future. So worldwide, we deliver critical services to those displaced and the host communities that support them. And of course, we help individuals and families uprooted by this crisis really to resettle as well as regain their new life. And improving health outcome is critical to our mission. That is the department I lead at IRC. In more than 30 countries affected by crisis, we deliver health programs, that seek to ensure, children, which constitute the majority of people affected by conflict, are treated for and protected from leading causes of death and disability, such as pneumonia, diarrhea, malaria, malnutrition, as well as we provide people with the comprehensive support they need, including mental health, and as well as manage long-term health conditions like cardiovascular or diabetes, as well as we guarantee access to reproductive health services, such as increasing access to family planning, in crisis zone, and also supporting healthy pregnancy and childbirth. So through this work, of course, we aim to provide those most at risk and marginalized with the best quality available. And we also conduct research at IRC to understand the most effective way of delivering service for the most people affected by crisis. So that's what we do, and that's what IRC stands for.
Well, thank you, Dr. Tessema. And I think that underlying the point you made about people are fleeing for their lives. And some of these crises have been, these displacement of people have been going on for decades. Some are old, some are new. Perhaps you can just share with our audience, give us a rundown of some of the top humanitarian crises causing the displacement of people around the world today.
Yeah, unfortunately, humanitarian crisis is on the rise, and of course, our work is more important than ever. And in this year alone, 2022, the United Nations estimate that 274 million people will need humanitarian assistance, and that is a record number we have never seen in a decade. And so each year, the IRC release what we call it watch list, which is basically detailing the top 20 countries at risk of humanitarian deterioration in the year ahead, using different indicators. These countries hold up to 10% of the world population, the 20 countries I'm referring, but nearly 90% of those needing humanitarian assistance. So really disproportionately few countries are being affected. This year, Afghanistan topped the list, of course, followed by Ethiopia, the most protracted, Yemen, Nigeria, South Sudan. These are the most, the top 5. Of course, in the Democratic Republic of Congo, which is, has been in our watch list for many years. This year it stands the 6th. Nearly 26 million people face crisis level of food insecurity, and under 1% of the population are vaccinated against COVID. So across the watch list countries, we are seeing growing hunger caused by a combination of COVID, conflict, climate change, record displacement, from violence, oppression, and of course other shock like a natural disaster. And of course, the impact of this disaster is disproportionate on children, women, and girls. So what we need to remember is in each of these crises, there are millions of people caught in the middle, who are forced to flee their house, as we call them, displaced, either refugee or internally displaced, and also uprooted from their livelihood and their neighborhood. So it's really economic collapse, broken health system, resulting in no service or no future for their children. So really, when we start to see coverage of war and conflict, the one we have seen on our television today, what it truly is actually is a humanitarian crisis, a displacement crisis with people running for their life to find safety and protection. So that is the kind of situations that we are seeing, through our watch list countries.
And I think, going down the list, it's stark to, I think many people may not know that in Afghanistan, I believe 95% of the people are food insecure, a number it's almost inconceivable. I find also, Dr. Tessema, a lot of people are not aware of conflicts that have been going on for a long time, like in the Eastern DRC, where this is hard to actually grasp, that more than 5 million people have died as a consequence of conflict that continues to erupt in the Eastern DRC. These are ongoing crises, and the numbers are staggering.
Yeah. That is what we are looking at, really, in terms of number. It's not just only the people who are direct casualty of war, like the combatant. The most affected are civilians, and the number that you quoted are actually the civilian population who are not direct participant of the conflict, but they are indirect casualties, either through hunger, displacement, or disease caused by the conflict that displaces them from their neighborhood.
Yeah, and there are different types for people who may not be aware. There are displaced people are different. There are different categories with different needs, right? There's refugees, asylum seekers, displaced persons, IDPs. Can you share with the audience a little bit about what the differences are, and are there different needs for these different populations?
Yeah, people migrate for myriads of different reasons, and of course, international law classifies them based on their legal status. So one of the group, we're talking about, refugees, for example. These are people who have fled war, violence, persecution, and many of them, they cross international border. That's what makes one person refugee, crossing international border in search of safety and security from another country. So today we are talking about 26 million people who are refugee or refugee-like population across the world, and half of which are, children under the age of 18. And of course, many of them, they live in a protracted situation, and there is international law that provides protection for the refugees, and through a Human Rights Convention as well as a Refugee Convention. So it's also worth noting that 2/3 of people who have fled from their countries come from just 5 countries. That is Syria, Venezuela, Afghanistan, South Sudan, and Myanmar. I think it's worth noting, that some of this may not appear on news. I think, places like South Sudan is actually many people are leaving their home. And the other group, we call them internally displaced population. These are, people who have been forced from their home by conflict, violence, and the same situation that caused the refugee. But the difference is that they have not crossed international borders. So they are within their own country or their habitual place of residence. So there are about 48 million. So the majority of displaced population actually live within the territory they, where they have, their legal status. So, of course, IDPs are also equally entitled for the same right and protection like refugees. And of course, there are other types of displacement, refugee-like, people who have fled across international border, but really have their refugee status have not yet been determined. So, different legal status, but I think the common criteria for all of them are, they are displaced by conflict from their neighborhood. So the needs of this population, by their nature or the context or the geography where they live, can look different. And of course, as I mentioned, children are particularly vulnerable, and where majority of them are children under 5, and they do need specialized attention, both for their own physiological need and development, as well as for their future, including education. Of course, they need to get assistance, and probably it's worth noting that in recent years, 1 million children were born in into refugee life. I mean, that is the number that we're talking about, people who are living outside of their habitual residence. So really, regardless of the cause of migration and their legal status, people deserve to have their right protected and assistance provided, and ensuring that they participate also in economic life in the place where they end up, so that they can contribute to society, in their newly adopted home, and as well as, of course, they also contribute to the places where they left, through remittance. So they are not only vulnerable, they are also an asset for any society. I think, many communities benefit from hosting refugees.
Absolutely, and I know I'm Canadian, so I'm also a refugee times, no, I'm an immigrant, sorry, times 2. So I personally certainly appreciate something what Canada gave to us, and I'm here in the United States. But indeed, at least in my country, in Canada, immigrants and refugees have played a vital role in growing my country. If we could talk a little bit about children, because I think it bears speaking, as you mentioned, Dr. Tessema, you were the Senior Director of Health at the IRC. So you see and know the impact, the particular, potentially devastating impact that being a displaced person on children have, particularly the numbers of children, children living in stressful environments, the lack of nutrition, or the cortisol levels that affect their cognitive development, their neurologic development, particularly in the first 5 years of life, can be really devastating for the long-term trajectory of that child. Can you share, and they're also subject to sexual exploitation, violence, and exclusion, a lack of education needs, access to healthcare. Can you share with us, how urgent are these needs for children, and what can be done to improve access to care and protection for children as displaced persons?
Yeah, the children, certainly they are the most vulnerable in many ways, physiologically, and as well as, the protective environment that exists in the community, during war and conflict that tend to be, broken down. So really, they do require special protection. One area which we are, increasingly troubled by is that the number of children who are malnourished, because of, lack of access to adequate diet, and also exposure to disease and infection. And at any point in time, if you take only one aspect of malnutrition, which is, severe acute malnutrition or wasting, nearly 50 million children at any point in time are acutely malnourished. And I think that's a staggering number of children. But the thing is that also acute malnutrition is preventable and also treatable, and there are solutions available. And unfortunately, our system actually is failing these children because only 20% of children today are getting the treatment they need, and putting them at increased risk of mortality and morbidity. So at IRC, actually, we've been working to improve the system and break down the silos that exist in terms of treatment protocol, and ensuring that care are delivered through decentralized system using community health workers, using the ready-to-use food, which is peanut-based batter, which is can easily be stored and distributed even in the most difficult context. So there is solution available. It's possible to deliver even in the most difficult place, but I think we do need the UN system really to get their act together, support these types of approach, and as well as, of course, donor to support this kind of service. Because I think that the problem is that if you don't address this issue quite early, these children are at risk of mortality, and also they rob their future by losing their cognitive capacity. So yeah, I mean, I can go on, other issues like infectious disease, like measles and other, which is a problem in many places where refugees are living, but which we have easy solution to deliver, but it's not reaching the people who need them.
If you had to, that's a critical point, that what happens earliest in an individual's life has profound implications from the prenatal, particularly to the first 5 years of life, as you described. If you had to describe some actions, Dr. Tessema, on the coordination side, whether there's better coordination is required, and if so, what would that look like? What are the actions that need to take to be able to scale up in a more effective way the interventions we know will improve the lives of children and prevent a lot of the challenges you mentioned?
Yeah, I think the solution is simple. I think we do need a single UN leadership. At the moment, treatment of malnutrition is, role is shared across different UN agencies, like UNICEF, treating severe acute, the World Food Program treating moderate acute malnutrition. The WHO set the standard. And I think what we need is a single agency that is mandated to deliver treatment for acutely malnourished children, irrespective of their severity, and having a single supply chain system so that we reduce inefficiency in the system, and also allow national government and organizations like IRC to deliver services through community health worker and community-based infrastructure, rather than waiting, to be, using inpatient types of model or health system-based delivery mechanism where, the health system doesn't function in many of the places where we are working. So that is the kind of leadership that's needed. And we are encouraged by, the Global Action Plan for Wasting, which was adopted by the UN, but it needs to be implemented. It needs to be supported with the financial resources needed. It also need accountability to ensure that everyone fulfills their commitment so that, we can reach those children who need our service.
And one thing we've been, thank you for that. One thing we've been looking at and exploring, and I really appreciate your insight into this, is how, and it was the issue of using community services. How can we do a better job of actually mobilizing, training, or utilizing the skills that exist amongst displaced persons to provide the services that their communities are needing, the people in those sites? Is there a way to do that which would bring that care and also delivery down to the community level? Is there a better way of using refugees in that space?
Yeah, absolutely. Refugees, they travel, there are healthcare workers among refugees. Yes. There are community workers, there are teachers, and even lawyers. And they are, and like any community, they have all types of, human resource that's available within refugees. And those resources would have to be utilized to deliver better service because they speak their language, they understand the context, they will be able to deliver the service that is suitable to the population that we are targeting. So at IRC, we have experience of working and training refugee community health workers, to provide care for children, even home-based care, home visit, and as well as delivering this nutrition even at the community level. So yes, absolutely, I think that's the way to go. And many of the conditions we are talking about are easily treatable and preventable. We don't need hospital or tertiary care to address those conditions. And I think with the care of cadre of community health worker, we can deliver better quality service.
And the rate of return on the investments are cheap compared to the cost of inaction downstream, isn't that so?
Yeah, absolutely. I mean, a community health worker, it's not like you are training a doctor, for 7 or any years to treat malaria. I think it's more cost effective, and also it's the most appropriate for the context we're talking.
Dr. Tessema, the issue of refugee protection is an important one, because we've seen so many horrendous cases of refugees and displaced persons being victimized for who they are. How can refugees be protected more adequately, whether they're IDPs or whether they are refugees?
Yeah, in the report that I mentioned about system failure, the challenge is all about failure of states to provide protection to their population, and also a diplomatic failure. I mean, we have seen Security Council paralyzed from taking action, in the face of grave threat. And of course, legal barriers and how this international institution function, and operational challenge in terms of having access to the population that we serve. So really the report detail out the prevention is possible with good governance and political will. So there is a need for, of course, system reform. And if you are interested, I encourage you to listen to, read our president, David Miliband's speech on this topic as a Council on Foreign Relations earlier in this year, or one of the op-ed that he wrote. So, but I can quickly say there are 4 key changes we can make to help prevent this crisis from happening. One is, although humanitarian crisis on the rise, I think the recognition that political settlement to these issues are declining, and which is represent a continuation of crisis, hardship. So we need to reinvigorate peacemaking, peace building effort to help end violence and reduce humanitarian crisis. That's one area which I would highlight. The second one is we need to depoliticize humanitarian access. Today the UN system, NGOs like the IRC, we can be restrained in our speech due to the fear of losing access to the population, because I think we want to be there to help the people, and speaking out also has a cost. So we are always every day trying to balance out what is the right way, in terms of helping these people. So, we do need a system reform, perhaps maybe establishing an organization for protection of humanitarian access. I think that is one way to protect people from persecution and violence. The other one is, institutionalize and respect for humanitarian law. We have seen, healthcare facilities, health workers being attacked with impunity, and schools being used as a staging ground for war. And I think we do need a better protection of international law. And of course, which is, we also need to expand the use of universal jurisdiction in terms of accountability, holding those who are perpetuating this crisis to be tried in anywhere. So unless the system is reformed to address the myriad of issues that makes the system ineffective, unfortunately, we may see more people, trapped into conflict and without seeing light at the end of the day. So none of these actions, for what I said, is easy, but it can be done.
And thank you for bringing up the issue. We will actually access the report, Dr. Tessema, that you mentioned in Mr. Miliband's speeches, and we'll share them throughout our network and attach this to this. So thank you for that. Thank you also for bringing up the issue of healthcare workers are being targeted for violence, including healthcare sites. We ran a session recently with Professor Len Rubenstein and Dr. Zahir Sahul on this very issue. And so I'd encourage people to take a look at that webinar we did a little while ago. One thing that people may not know very well is that the places where refugees are often in low and low-middle income countries like Jordan, Lebanon, Pakistan, Bangladesh, Sudan. How can those countries are often resource limited? What can be done in a more effective way to actually support those countries in the work that they're doing to be able to provide for the refugees that are within their countries?
Yeah, I mean, you are right. 85% of refugees are hosted in low and middle income countries. Take the example of Uganda, hosting the largest number of refugees from South Sudan. And Uganda is also struggling with own resource to provide care for their own population. So, the concentration of refugees in these low and middle income countries, with limited resource to their own population, create additional strain, obviously, right? So as a global community, both the UN and NGOs, we have a role to play in terms of providing support and offering international solidarity. And also, I think it's also a responsibility for the host countries to allow, humanitarian organizations like UNHCR, like us, IRC, to provide care when they cannot meet those needs. So there is, in 2018, the global community agreed what we call the Global Compact on Refugee, which outlines some of the steps to help refugees and displaced population and their host communities. And the compact seeks to ease the pressure on host countries by enhancing refugees' self-reliance in terms of employment opportunity, expand access to third country resettlement, to find a durable solution, and of course supporting the country of origin to basically reduce the risk of humanitarian crises that cause refugees in the first place. So really it is calling the international community to use this global compact, show solidarity, supporting those countries who are hosting large number of refugees who don't have the means, and using this compact, to expand the collaboration that can be provided to these countries. So we have international instrument, we just have to use it and step up our support.
And so the last question, Dr. Tessema, before I just close with any additional comments you want to make, is on the issue of resettlement and repatriation. Mm-hmm. You gave some spot-on comments about the need for that. Are there any other additional comments you can share with us in terms of what is needed to be able to facilitate the repatriation or resettlement of refugees that sometimes have been living in camps for decades?
Yeah, the refugee crisis, it's a complex challenge, but it's also solvable. We are dealing about migration, mixed migration, and people who are running persecution. So there are three mechanisms to help them. One is, helping them integrate in the country where they have settled, whether that is South Sudanese refugees in Uganda, really providing better integration, and also helping them return to the country of origin when situation permits. The third one is providing resettlement to countries who have the means. Most of them are high-income countries like the US and the European. So, the US has been a leader in that area. And of course, different US administration has made a commitment. And we are encouraged by the Biden administration actually to increase the cap for refugee admissions this year. And we do need, that types of commitment from other countries who have the means to increase admission and integrate more refugees. And as I said in my earlier remark, that refugees comes with a skill, and when they are welcomed and better integrated, they contribute to the country where they are received as settled, and it enrich our culture, it enrich our economy, and also it's a great force for good and solidarity and global collaboration. So those are some of the steps that we can take, and I think what we have seen, what US has done to increase, the uptake of refugees. Hopefully other countries will follow.
Thank you, Dr. Tessema, and that's a wonderful way. Just before are there any closing comments you'd like to make before I thank you? Are there any points we missed that you'd like to share with our audience in terms of the global refugee crisis and what we can do together? We have a membership of 33,000 people in the Consortium of Universities for Global Health, plus many more in our network. Is there anything else that you'd like to convey to our members of what they can do to help in this effort with you and the IRC?
Yeah, the refugee crisis, the refugee situation, it does require all of society response. I think everyone has something to contribute, whether that is volunteering in your neighborhood to help and welcome refugees. When the Afghan refugee arrived here in the US, communities has rallied and come together to welcome and, give them a place and a home and opening their business, for their arrival. That's what you can do in your own community. You can also volunteer with organizations like IRC as a humanitarian organization to help address, or provide service refugees living in low-income countries, middle-income countries, where we need healthcare workers, we need researchers, we need, epidemiologists and anthropologists. So anyone with a skill set like that, your skill is much needed, to provide care in the places where we are working. And of course, we also want you to support, the work that IRC doing. That include your financial contribution is welcome, and help to provide health care to a child in living in Uganda or any place. So I think there is plenty of way of to help refugees, and if people are interested to learn more about the IRC work, you can go to our rescue.org website, and there is plenty of resources that they can look at. And of course, happy to answer also any question, and of course, feel free to reach out. So thanks very much.
Well, Dr. Tessema, thank you so much. It was a very powerful interview. You well described the plight, the challenges, and the opportunities to be able to improve the lives of refugees around the world who are really victims and a consequence of political failures that have caused circumstances to force them to flee for their lives. And you provided a number of concrete solutions that you and the IRC are doing. We will certainly encourage people to look at the IRC's website. And I think as Dr. Tessema mentioned, there are many things that all of us can do to be able to address and improve the lives of those who are fleeing for their lives, whether they're in our own communities or internationally. And I think if all of us do that, we'll hopefully lessen the growing burden of people who are a victim of circumstances outside of their control. Dr. Tessema, thank you so much for taking the time to speak with us today. We wish you the best of luck and good fortune in the great work you and the IRC are doing to improve the lives of displaced persons around the world. Thank you.
Thank you, Keith. Thanks very much.